My name is Mitch Lee. I'm an emergency physician. Some of you know me. Some of you have just joined for the first time, which is awesome. I started the group Take Medicine Back, which is a public benefit LLC, um, with a huge movement. So I founded the group, but there is a huge movement behind that. And we are transitioning to a 501(c)(3) soon, but we are moving towards that. So that was April of 2021. And we've had several online virtual summits, during COVID time, and we're having our first Take Medicine Back and co-sponsored with the California American Academy of Emergency Medicine in-person summit on February 10th, on Saturday in Palm Springs, California. So you can go to takemedicineback.org. It's right there if you want information, and there's still time to register potentially in person, or we also have a virtual option. So what I wanted to do is get a real crash course on the corporate practice of medicine, because the impression that I've gotten over the past couple of years is that we're all dissatisfied. I mean, unless you are really, really actually sold out, the vast majority of us are dissatisfied, or maybe you're leaving your career and you've had a good career and you're kind of like, wow, I'm glad I'm getting out now, and good luck to the rest of the world. So I haven't talked to many physicians at all that are happy, unless they're really actually like truly is sold out. And so we have this background and feeling of moral injury. I saw Wendy Dean's here. There's something causing us moral injury, burnout, better defined as moral injury. And we hate corporatization, and we hate admin, and it's scrubs versus suits. And we've got this sort of gestalt as to what's wrong. But what we haven't done is talk about what are the actual historical context of this, and what can we do about it, um, with a legal and historical basis. So we know there's things like the Stark laws, and we know there's things like physicians can't own hospitals. But what I realized in the course of learning about this over the last several years is that we have older physicians, I'm sure, than me in this group right now, but the very few of you are probably 78 or older. And that was the last time, if you're a practicing physician around the 1960s, that the corporate practice of medicine, actual legal prohibitions were enforced. And some people, legal scholars and stuff, have known about CPOM, but have just considered it dead. Um, what I'm kind of here to say is that it's being revived. And for the emergency physicians in here, we're resuscitationists. And there is a real opportunity for revival and resuscitation of this, but then also to frame it in this historical and legal context, so that whatever else we pursue, which might be, Stark law reform, or due process rights, anti-retaliation laws, unionization, anything can be put into this context. And we can drive a legal movement, legal and social movement, essentially, to take our profession back. So I'm going to jump into it, and sort of a little bit of history, and then bring us to current day. And I'm going to go zoom through and skip over a lot of details, but hopefully it's enough to get things in historical context. So HBO series, The Gilded Age. I have watched the first three-quarters of an episode, and I mostly lost interest, but maybe it's good. I haven't gotten hooked yet. The point is that the Gilded Age was a time in our history, basically around the Industrial Revolution and the era of monopolists. This was a time of basically great wealth and wealth inequity in our nation's history, after the Civil War. And this is where we get groups like, or names like, the robber barons and the big steel trusts, the copper trusts, the mining trusts. These were all big industry fat cats that at the time were felt to have controlled Congress. So this is a pretty iconic image from back in the day. And there was a feeling that this was wrong. That basically we shouldn't have wealth concentrated in the hands of the few, and that the government wasn't working for the American citizens. So I put this in context too, because a lot of us feel that that's the case today. So I'm going to put this in a very vague historical Star Wars terms. So bad things were already happening, and that's the case in the first iteration of Star Wars. There were three general responses to this serious wealth inequity in the country. And this is the profession of medicines. So this is the American Medical Association 2013 report from the Council on Medical Service report. And they said in the very beginning, the corporate practice of medicine concept dates back to the 19th century and was integral to elevating the medical profession and ensuring the autonomy of physicians while providing an ethical basis for the practice of medicine. And the report was overall very weak. It was a very weak report. The AMA now basically says you can enter into contracts however you want to, and that they have that in actual policy. Like you can work with a corporation, basically sell yourself out. So this just puts things in historical context to me, because I feel like maybe the corporate practice of medicine, if it was integral to the ethical basis of medicine and in elevating the profession and our autonomy, is maybe everything. That was the medical profession's response to this great wealth concentration. And this is what happened after the doctrine, the corporate practice of medicine doctrine, was created essentially by the AMA, which is a much different AMA than it is today. And state medical practice acts essentially were put in place in order to stop the unlicensed practice of medicine. And back then, there were, of course, like charlatans, lots of snake oil salesmen, peddling, cure-alls and stuff like that. And so the profession of medicine sought to set itself apart in a number of ways. One, we couldn't enter into contracts with lay entities, meaning non-physicians. So we couldn't be employed by non-physicians. And that was an ethical standard that was enforced by the AMA at the time. And then the other thing is that we actually couldn't advertise. I'm not sure exactly when that became a ethical or legal law, but the concept was that snake oil salesmen advertised. They were not really advertising and competing so much as making fraudulent claims and making outrageous claims that would basically mislead patients who might be vulnerable to things. So we were like, we're going to be better than that. And of course, right around 1910 is the Flexner Report, which we know has some criticisms, critiques, and all that. There's, historical race dynamics at the time, but we did establish a scientific basis and a requirement for medical school to be 4 years, and essentially started standardizing medical education in the United States. So that was what raised the medical profession, as we know it today, sort of to the stature that we're in. And then state medical practice acts incorporated it throughout most of the country, although many states barely incorporated it or made it to statute. And then Supreme Court cases sometimes set precedent. And if you're not a lawyer, I'm not. I've just learned a little bit about it. We're kind of thinking the difference between like Roe versus Wade versus creating statute to say that abortion is legal or whatever. It was a Supreme Court decision, which is not as strong as statute, which is legislation being created. And so a lot of the basis of this is attorney general opinions and Supreme Court decisions, and they date up to roughly the 1950s. So the United States' response, like basically the government's response, was essentially the antitrust movement. Now, we hear about antitrust laws, but I don't think many of us realize what trusts are. It should be the anti-monopoly movement. Most of us would understand that more intuitively, or the pro-competition movement. The idea was that the trusts were anti-competitive and they were squashing the little guy and other businesses that could actually, compete and make things better for the public, and small businesses compete and everything like that. So the government basically started the antitrust movement. I think it was starting with the Clayton Antitrust Act. I think it was 1890. And then moving forward, the Federal Trade Commission Act essentially created the Federal Trade Commission at some point. And there were more people involved in this movement, but Louis Brandeis was probably considered one of the great fathers of this. So I believe he's a Supreme Court justice, famous for a lot of quotes, but we can have democracy in the country, or we can have great wealth concentrated in the hands of a few, but we can't have both. And here's where I'll also just interject a little bit of not partisan politics, which is we tend to demonize big government and we demonize big corporations. And Louis Brandeis would say if we have concentrated power in the hands of the government or the big corporations, bad. Concentrated power, bad overall. So I tend to align myself with his general thought process, which is that concentrated power, not so good. So if you have single payer with a tiny elite in Washington, potentially bad. And so there's a difference between the idea of sort of Medicare for all and big government will fix everything versus big capitalism. But right now, what we have is crony capitalism, and some people will call that socialism. I've realized I've talked to some people who that's their definition of socialism. Whatever yours is, they look at this because they left other countries because it was basically corrupt government. So labor's response to this was the labor movement and unionization. And this was, early or late 1800s, early 1900s. And so there was this sort of trifecta of responses. Most people know about the antitrust movement, or if you study history, and the labor movement, and you probably don't hear about the corporate practice of medicine. We're fortunate enough to be part of that mainstream society. There was a middle class, right? We talk about the death of the middle class, and essentially, through the 50s and 60s, and maybe into the 70s a little bit, that was there. And then a historical inflection point was Robert Bork, another Supreme Court justice, I believe, wrote The Antitrust Paradox. And I won't get into the details here, but we can just say that the antitrust paradox basically led to Reaganism in a really like simple context. And it redefined and weakened antitrust law without actually changing legislation. They changed the interpretation of it and rules so that mergers could basically happen and consolidation could happen of companies. And the idea was as long as that brought the cost down to the consumer, and that's called the consumer welfare standard, that it's fine. And so kind of that's like Amazon. Amazon, we kind of like it. We can get our stuff. It's cheap and we get it fast and we like it, but it's maybe not done the best thing for labor under Amazon. And they also maybe have put a lot of other businesses out of business, and that maybe has actually hurt innovation and price competition in the long run. So it might actually be hurting the community, but also us. So Bork kind of is an inflection point. At the same time, in the 1970s, the Federal Trade Commission took action against the American Medical Association. I don't know what number of physicians are represented, but probably like 50 to 60% at least of of physicians. And this was, that was now it's like 10%, 10 to 12 is the estimation. So to put it in context, way more powerful, even including amongst physicians. And they still had the rules that you could not advertise as a physician because they didn't want you to look like the local charlatan. And they didn't want you to enter into a contract with a lay entity because the idea that that a corporation controlling the practice of medicine, a corporation that does not have any ethical, like professional ethics, and or fiduciary responsibility to the patients and is looking to get profit from that relationship, they should not be there on an ethical basis. And I think we all kind of intuitively agree with that. But in the 70s, the idea was, and there's probably some basis to this, the AMA fought universal health care, whatever that meant, for decades, and also had been accused of acting on as its own guild and basically raising the cost of services and being anti-competitive. So we were considered a learned profession at the time, which is basically, somebody above the general public. And that might sound elitist, but the idea was that lawyers were traditionally considered of the learned professions. Physicians were considered of the learned professions. Teachers, which, going back to universities, and clergy, and then we discovered science, and then there were some sex scandals, and clergy kind of went away from the learned professions. And then medicine got attacked in the 1970s by the Federal Trade Commission, basically saying that we should advertise, because if we advertise, we can share our prices. And if we share our prices, it'll go down because we're going to be competing against one another and lower cost. And that we should be able to enter into contracts with lay entities. And the first lay entity was essentially HMOs. And so healthcare costs were rising at that time. So a bunch of MBAs, business people, came along and said, well, we're going to be way more ethical than these physicians. Trust us, we'll make everything really equal and fair and control the physicians to control costs, right? So, like, obviously, we should have trusted the MBAs, which is what we did. So the HMO Act of 1976, it might be wrong. That was a bit of the lobbying that was behind the actions of the FTC against the AMA and weakening of the corporate practice of medicine doctrine and laws altogether. So really, this got weakened over a series of FTC actions, Supreme Court decisions, 1970 to 1980. And then an interesting fact, if you do look at this and you think, did it make this lower cost, our healthcare system? Look at 1970 to 2018, and the cost of the healthcare system as a percentage of GDP has just about quadrupled, and probably more in the last 5 years. So at the same time, our salaries did go down as employed physicians, which 75% of us roughly are employed by corporations at this point, which was a massive uptick after the pandemic. So, so the FTC was right about a couple things. We're competing on the basis of our labor, and we become a commodity. And so our costs have gone down, but the saving of our lower salaries has not been realized by taxpayers and the average American getting insurance. As you all know, it's gone to huge corporations and private equity firms and insurance executives. So here we are, screwed over by society. And I'm skipping a whole bunch, but also the medical profession started kind of getting these signals that we were allowed to commoditize ourselves. And so people within the profession of medicine started commoditizing others within the profession of medicine. And I would probably say that emergency medicine was the first to do that. And the specialty of emergency medicine, I think it was 1979, that it was recognized as a specialty. 79, 69? Okay, I could be off. Point is, right around that time, we were born into an era of when after medicine was already basically stripped of its learned profession status. And there were elements within emergency medicine that were happy to hop on that train and start commoditizing the rest of us. And so that was basically yes, this is probably where I meant to put the slide a little bit earlier. This was documented in the sort of cult fiction book, I guess, quasi fictional book called The Rape of Emergency Medicine. It was the 1990s. It probably could be renamed The Pillage of Emergency Medicine for a little to be in this century. But the point is that there was a documentation of leaders within our specialty who realized they could make money off of the labor of other physicians, which in some laws and in ethical ideas could be considered illegal and or unethical fee splitting, where you're taking the labor of another professional and you're making money off of that, as opposed to, maybe if you're going to employ them, you can give them, enough, whatever the overhead costs for the services that you're giving them as an owner. Whereas fee splitting allows profiteering off of the backs of physicians. So this led to the contract management group model, the idea where instead of and this is within emergency medicine, hospital-based specialty, a few physicians staffed a hospital and they all had equal ownership, or maybe they bought in over time through their labor or through money, and then they became partners, and just like law firms. Instead, there were a few folks who figured they could be really savvy. They learned the business and got contracts at multiple hospitals, and then started just staffing warm bodies. So there was no real consideration as to, is this a really good doctor? Is this somebody who's going to be good for the community? With more, is this person going to work shifts for the lowest cost so I can make the most money off of them? And if they're a bad doctor, as long as they don't piss people off, they can kill people, but as long as they don't piss an admin off, we'll just shuffle them around contracts and they can make money off them. So that commoditization was really like innovated by the profession of emergency medicine specialty. You fast forward in the past like 10 years, private equity firms, which tend to take a stable business model that is already making money, and then they'll say they'll invest or whatever, but really what they're doing is pillaging that model. So they already have a model that was making money. It's a mature business as opposed to venture capital, a subset of private equity, which invests in sort of like new startup stuff. PE is taking on um, established business models, and Toys R Us as an example. Toys R Us is no longer with us today because private equity murdered it. And that's kind of what's happening to the profession of medicine. So this occurred in 1992. And then in 1993, the American Academy of Emergency Medicine was formed in response to this book, and with the feeling that the American College of Emergency Physicians had left its ethics. Now, I know the center of the world is an EM, but I think we are unique in that we were formed right when this inflection point happened in history. So we look at the Envision lawsuit today. This is the American Academy of Emergency Medicine, which is sort of like the arch nemesis resistance against the American College of Emergency Physicians. To be fair to the American College, they have changed a little bit in the last several years, but mostly, in my opinion, due to massive membership loss because people have realized how much harm they've done to our society and our specialty. So there's been some changes there. They actually oppose the corporate practice of medicine on paper now, which is a longer conversation. This lawsuit, the American Academy of Emergency Medicine launched a few years ago against the corporation Envision, which was owned by KKR, a private equity firm. You'll learn more about private equity when you go to the conference. For our keynote speaker, Brendan Ballou, we're not all about private equity. Some people think that we're just anti-private equity. We just think that's sort of like the accelerant to the fire that's already burning. This was basically, let's pour jet fuel onto the fire that was already burning. That's private equity as far as how we view it in terms of the corporate practice of medicine. So the Envision lawsuit is not seeking monetary damages. This is 30 years of private foundation funds from a small private group of emergency physicians that is now suing Envision not to get any return on investment or financial damages, but to set precedent. And this is the key. They are suing Envision in the state of California. For any legal nerds here, the reason this has kind of taken a while, one of the reasons is because AAEM needed standing, and they do have standing by some minor financial damages that were done. So it gives you the ability to sue, but you don't need, they're not seeking financial damages. So they're going to continue this until a judgment. And the idea is that there are strong corporate practice of medicine laws on the books that are not being enforced. So if a court enforces those, then they set precedent. Like, these laws are actually relevant. And the idea is that Envision, owned by KKR, is actually practicing medicine by employing a physician that's known as a paper owner. And I don't think I actually put anything in here. So on that, so I will, I'm going to give you a little background on what paper owners are and the mechanism. I don't want to lose you as far as this getting technical, but it's very important. So the idea is that most states have laws saying that you cannot, if you're a corporation that's not 100% physicians, you can't own a group that practices medicine. You can't influence a group of doctors by owning them and then practice medicine through them. And the concept here is that a corporation, by nature of being a corporation, cannot go to medical school, can't meet the requirements of completing a residency, and then take the tests, AI aside. They can't meet, by not being human, and they can't have an ethical responsibility to patients. And so a corporation can never be licensed in medicine. So unless that corporation is composed of all physicians, then a lay corporation, non-physician, cannot employ physicians because they can influence how they practice medicine. So the concept here is, on paper, lawyers have realized and corporations have figured out how they can make it appear that a physician owns the group. And they do this by taking a physician who then signs a piece of paper that says they own the group, and they sign another piece of paper called a stock transfer restriction agreement. And this stock transfer restriction agreement basically strips them of all power of ownership. They can't transfer stock. They can't add a partner. They can't sell the group to another physician. They can't make any actual decisions in the corporation. So they're a figurehead. So paper owner, figurehead, straw owner, captive physician is actually how a private equity executive actually described those physicians to me when I met them on a hunting trip. That's a long story, and I made him a cocktail, and I learned all about this, and he called them our captive physicians is actually what they actually call them. So there have been some discoveries of these physicians because oftentimes you don't know them, you don't work with them. That's the point. They are behind the scenes, maybe licensed in 30 or all 50 states or whatever number of states we have. Basically, their name goes on the paper, and that's how corporations from United Health to Amazon to the private equity firms, Team Health, Envision, to right now Hims and Dunn, Cerebral, like all of these corporations that are employing physicians, that's how they're doing it. They've got one physician, maybe a few, pretending they own the group and basically lending their license out. I wanted to say a worse word, and I don't know the audience tonight. So fast forward, AAEM started 30 years ago. I can tell my story another time, but I was pissed off at what I saw happening as an emergency physician and realized that we need to do this as the whole profession of medicine, and we need to start involving the rest of society because we've been maligned by society as so much as like the cause of everything bad in healthcare, and the corporations have such a PR machine that they continue this lie. So of course, the story is complicated because some of us have sold out and are aiding and abetting the corporate practice of medicine, but that's not the vast majority of us. So we worked on a white paper, working paper called The Corporate Practice of Medicine, a call to action to take the profession back from corporate interests. At the same time, as you see, October 2023, this was published roughly the same time. So actually just before we published, this is September 14th, 2023. A Doctrine in Name Only, Strengthening Prohibitions Against the Corporate Practice of Medicine by Jane Zhu, who's a physician in Oregon, and then Hayden Rook-Ley and Aaron Fusé-Brown, two JDs. And similarly, at the same time, we have Mark Hall and Aaron Fusé-Brown writing another legal review called Private Equity and the Corporatization of Healthcare. I didn't put all the details in here, but they basically call for a revival in strengthening and enforcement of corporate practice of medicine prohibitions in order to fight what everybody's starting to see as just enormous corporatization and financialization of the healthcare system. We were actually quoted in this and cited in here, and I didn't even realize it. Now I know Mark Hall, but we were cited because we had written a letter as Take Medicine Back to the Attorney General of North Carolina, who is supposed to be the next president of the National Association of AGs, in order to launch an investigation into the broad and almost universal lack of enforcement of CPOM prohibitions in the country. That AG did not become the president, I think because there was a push to make sure it was a Republican and then a Democrat every year and whatever. So it never got that far, but it is continuing the discussion in North Carolina. And at this point has resulted in a discussion between me, the medical board, the Attorney General's office, and legislators. And we have corporate practice of medicine prohibition legislation being introduced in the short session in about a month. So we didn't know any of those, and that's one of the things that gives me a lot of hope here. All of these lawyers were writing the same stuff at the same time that we were working on our white paper, and none of us coordinated, and now they're all coming to our summit. And Brendan Boger too. So he wrote Plunder, Private Equity's Plan to Pillage America. And then David Milstein is the litigating attorney for the Envision lawsuit. So all of them are coming to our summit on February 10th. We've built up a much bigger bench of attorneys than this, but only so many can fit on a page. So we're building alliances with these legal scholars. And Mark Hall is really unique because he actually was one of the people who argued essentially to screw us over back in the 70s because he thought the doctors were acting like monopolists. And now he's like, I guess we didn't see private equity coming, and those guys are worse than you guys. So a little bittersweet, but very powerful actually, because of that historical context.